Good evening, everyone. This is Brenda Ahlberg, Kenai Peninsula Borough Information Officer, and with me today is Dan Nelson, our Incident Commander for our Incident Management Team. Thank you so much for joining us tonight. We are going to provide you an update, and then we're also going to fold right into questions that you may have. We'd love to try to help you out. If we cannot provide you the answer, then we're hoping that we can find you the answers. And please bear with us as we navigate through this new system called technology, Zoom, and we hope that we can continue to provide you an update at 7 o'clock. And with that, welcome, Dan. Thank you so much for taking the time out of your day to join us.
Thank you, Brenda, and good evening, everybody. Welcome. Glad to make this kind of a new, but hopefully a nice and steady tradition of meeting and talking with each of you at 7 each evening. So we'll look forward to those questions, but I'll just talk about a few things. It was a very productive day. It was a very busy day for our incident management team and for all of our borough and city staff, our healthcare workers, and everyone else. So we have a working group made up of agencies across the Kenai Peninsula, from the Central Peninsula over to Seward in the east, and then of course down to Homer and across Kachemak Bay. And that group is meeting every morning and working and identifying issues and working at things that we may need to do and may need to solve as this continued coronavirus pandemic affects us in many different ways here as citizens of Alaska. So that planning process continues as we get new information, and as that information and actions just continues to change on an hourly basis almost. So that really was our key for the day, was that contingency planning. Here at the borough itself, and I know in many of the cities, we're working on ways for the public to continue to be able to interact with us remotely, working on things like public meetings and online services and other things that we can do. And I know the private sector is also doing the same thing. I see some new restaurants and things that now have new online ordering in the past few days and those types of things. And that's just an example of some of the things that we're also doing as well. So that continuity planning piece is critical, and continuing that planning, continuing our contingency planning. So the borough has an incident management team that has about 10 or 12 people working on this, and the cities all also have an incident management team that we've been working with and been meeting with. So like I said, a good productive day, but we'll look forward to answering your questions tonight, I think, for about the next half hour.
Thank you for that. One thing I want to remind folks is that our borough facilities are closed to the public, but employees are still at work. We have folks, I think it's about a third of us that are working from home online, and then the rest that can are reporting to their individual facilities and continuing to provide services as best they can to our residents. And that also includes, in some cases, shift changes that have been made to ensure their safety and that they're practicing that physical distancing. I'm getting messages here that I'm hard to hear, but I'm going to let you answer that question while I try to fix my speaker.
Bear with us when we deal with technology. It is kind of a new thing here for some of us, and we're integrating this video conference in with Facebook, so that's provided some challenges. You are right. The borough facilities are closed, as well as many of the city facilities. If you're in business with the borough at all, there are definitely still ways to do that, in which you can interact with us online, by phone, by mail, or even the old-fashioned way, picking up the phone or doing any of those things, and including the Dropbox. So if you are trying to drop off paperwork, drop off tax payments, or any of those types of things, there is a Dropbox available for you outside. So we ask that you please put that information in an envelope, seal that up, and drop that into the Dropbox, and we'll be able to process that for you in just a few days as we get this sequence going. People are always free to pick up the phone and call us, 262-4441, or if you're outside the Kenai-Soldotna area, it's 800-478-4441. We'll get you to the right department and allow you to speak with whomever you need to get your business done. Same thing here as we provide online options. There's some online property tax option payments and a few other things on our website, kpb.us. So we really want to emphasize, everybody is still at work. Everybody is working hard. And there's different ways to accomplish business. So we appreciate you not trying to come in the office right now while we keep things safe for everybody, but business still continues to take place.
And I apologize while I was off air trying to fix my earpiece. I wanted to make sure that you had talked about solid waste and our first responders. Those services are still continuing?
They are. So the Central Peninsula landfill, as well as all of our transfer sites, are still operating. You might see some new procedures at the landfill just to keep people safe. And once again, as you're disposing of trash and recycling, make sure that you're keeping that social distancing with folks. Remember that 6 feet rule. And of course, our first responders, our fire and EMS departments, our 911 dispatchers are all at work to serve you and keep the public safe.
Thank you for that. We're going to go to a couple of questions if you're welcome or if you're ready to do so.
Let's do it.
All right. So we're having a lot of questions about the testing capabilities down here on the peninsula. Where are we at with that? And what is the protocol for getting a test?
So if you have symptoms or you're feeling ill, we've talked about this before, but it cannot be overstated to call your healthcare provider. Whether you're here, if you have a general practitioner, or a family doctor, or any type of healthcare provider, give their office a call and let them know what symptoms you have. It's likely that they're going to go through some screening questions on the phone with you, and then they're going to advise based on what you tell them what the proper course of action is, whether they want to see you, whether they want you to be home, whether they want you to get a test, whatever it happens to be. So definitely don't be going into our healthcare providers, don't be going into the hospital, call ahead so they can give you the right information. We are going to ask, please be patient. We're hearing that our local healthcare providers, they're pretty busy right now. So be patient when waiting for callbacks and things like that. There are also some telemedicine options if you have some of those. Some people's insurance provide that. That's another alternative. To get a test, you must have a referral from your healthcare provider. We're not able to give tests to the general public. And when you get that referral, you'll get instructions on where to go to get that the swab or whatever that testing procedure is going to be for you. That test is then sent out. It is tested out of state right now for the most part down here on the Kenai Peninsula. We don't have those higher throughput tests provided by that the state has and in some of those areas, and even some of the Anchorage test and that drive-through is still being delayed. So the test will be sent out in red, and then your healthcare provider will follow up with you. So the key word here on testing is we don't have those drive-through facilities or any of that at this time, but visit your healthcare provider by giving them a call first. Let them explain to you what the process is, and that's the best way to handle it.
Thank you for that. I also want to remind folks that are looking for a self-assessment, providence.org. Providence.org has a site online that you go through the questions, and from there that makes recommendations. And we are encouraging people to go to that site first if they have the ability to do so before calling their healthcare provider. Another thing I also want to remind people is that the statewide number that has been set up, 211, or in some areas you have to call an 800 number, 800-478-2221, is for basic information only. It is not to do that protocol of getting your recommendation from the provider. And I just want to remind folks of that those volunteers are doing a tremendous job, but they also are there for basic information only. So we want to be mindful of that when folks do call 211.
It's a great service that those volunteers are providing, and great information can be had there. But I know there is a bit of a wait there as well. So I think patience is also the watchword for today. As we'll ask our folks as you're looking to get that information or calling your healthcare provider or really doing anything. I think in these times that we're all adapting to, patience is a great thing. And so I know we thank you and your healthcare provider and those volunteers. Thank everyone for that as well.
Okay, one of the questions that's come up that I think is a really good question that you're pretty good at answering, I must say, is does the Borough website, we don't have it on the website, I know this for sure, but do we have something, a written plan in place that allows businesses that are looking for recommendations. And what I believe this person is trying to ask, and I could be wrong, Jessica, is that type of contingency planning. Do we have something like that for people?
There is some guidance. Yeah, there is some guidance out there for people. We have a little bit on our Office of Emergency Management website, and you can go to the Borough website to find that, kpb.us, and then you can click on departments up there in the upper left, and then find emergency management. It's under our preparedness page. That'll also link you to some federal guidance on Ready Business, which is the information that comes out of FEMA and the ready.gov at a federal level, national level, about things that you can do for your business. Essentially, we can provide some technical advice and maybe some guidance. If you can't find it on our website, you can reach out to us. Again, please be patient as we're in the middle of our response. But essentially, what we recommend businesses do is find ways to maintain continuity. So as I've just described, where the borough has moved to some remote platforms using this online tool is a great example. We have about a third of our workforce working remotely. Can businesses do that and still provide service? Some of your folks that maybe aren't public facing. We've seen a lot of great examples, as I mentioned earlier, of businesses that have moved to online ordering for their drive-throughs, new kiosks being built to maintain social distancing, maybe moving products or doing some of those things into more of an online or remote format. So those are just some suggestions of things that can be done. And that's what we usually go through when people ask us these questions, is talk about how your particular business looks. So start at the Office of Emergency Management website, kpb.us/emergency. If you can't find that, reach out to us by email or by phone, and we'll help guide you in the specific direction. If I didn't answer that, or that was a different question, let me know, and we'll make sure we were answering the right question for you.
I will provide that link online for under the appropriate posts that asked. Another question that's come up, and it's a little bit of confusion, or actually even interest, I'm sure, is that Nikiski Fire Service area provides limited resources, if you will, to those individuals that don't have potable water. That's a service of that particular fire service area. It is not done at CES, Central Emergency Services, or our other fire service areas. But I do want to point that out as a clarification. It's something that Nikiski Fire Service area does for those residents in that particular service area that do not have water.
Absolutely, and there is some new signage and procedures out there. So if you do live in that area, you find yourself that you do need to take advantage of getting some water from the station. They're going to have you do some new things to maintain social distancing, leaving your containers in a specific place. The firefighters will help you, or will take care of filling that water for you, and then once they get back inside, have you come and get your containers. So please follow their directions. And again, thank you for patience on some of those things as we have to modify our procedures to keep everybody safe and to prevent the spread of this virus.
I want to take you back to our solid waste department. One of the functions we have that's available to our residents are the slash piles when they are doing the defensible space around their homes, which hopefully the snow is going to be melting fairly soon, and we'll be outside creating those defensible spaces. People are going to be taking slash, and we just want to be mindful that those sites are still open. They're not going to be closed, but there is signage in place, and we want to encourage people to practice that physical distancing when they are removing their woody debris.
Absolutely, and brings a great point that summer is still coming. So even though we are, I think all of us have been a little bit distracted with things that have been happening, that is still happening. And again, those sites, like you say, will remain open. We'll ask for your help, though, to maintain that distancing.
What can folks expect when they go to Central Peninsula landfill or any of the other transfer sites that are manned? What can they expect now when they go?
What we're mainly doing is they're limiting contact with you, and also limiting things that might be a carrier or a transmission vector for the virus. So if you're out at Central Peninsula landfill, for example, you might be used to the laminated card that you get to help us track weights as you go in and out. Now you'll be getting a piece of paper. We're going to ask you to keep that piece of paper, not give it back to us. and you can take that home and dispose of it there. But that'll prevent the transmission of that piece of plastic being moved around between many cars. Same thing for those folks that are commercial haulers that are going to be handing clipboards back and forth and things when we have tickets to fill out. So just expect a little bit of a modification on those procedures for the general public. And if you do have tickets and things like that, then we'll be limiting our passing of that back and forth and recording things other ways. So shouldn't provide any further delay or any slowdown to the process. We're adapting, and they've got that process down pretty well.
Thank you for that. I want to give just an informal shout out to our local restaurants and individuals who are promoting the importance of drive-through and pickup and those efforts to sustain our local businesses that are taking an impact. It's heartwarming to see that on social media, those folks that are helping to promote that. That's very important. Another celebration of our small community rallying together during these times of crisis.
We're all pretty resilient. I mean, we're able to come out for our neighbors and for our friends. And, I saw the same thing the other day. I think I saw a whole stack of orders at one establishment waiting to be cooked. So, it's an important thing. We all know that the economic impacts of this are, we're just beginning to understand it, but they are far reaching. And, our neighbors and our small businesses and those people that have donated to our school fundraisers and all of those types of things over the years, I think it's a great thing. It's Friday evening. If you can, maybe do a to-go order and get yourself some dinner, don't cook, and help spread some of that around and keep our businesses afloat, keep our neighbors and friends employed. That's a great thing.
All right, let's talk a little bit about some of the grocery stores are allowing certain time frames where our elderly or senior citizens can go in to the grocery store uninterrupted, uninhibited with the crowds or by the crowds, so that they can do their shopping with hopefully a stress-free environment. But what recommendations do you have for our seniors when now all of a sudden they are the group that's in the grocery store?
The seniors, we still have to keep up with that social distancing and making sure that we're staying away that physical distance and preventing people from having that transmission. So we know that people can give and spread this virus without necessarily showing symptoms. So it's something that's real important for us, again, that at least that 6 feet separation. Sometimes it's hard. We might have to go skip to the next aisle, get something else, and then maybe come back if there happens to be a crowd. Most of our establishments also provide sanitary wipes that can help you disinfect your handles and your shopping carts and things. So definitely want to encourage you to do that. It may be something that you wish to do and consider using, if the store has it, those self-checkout machines. That'll prevent, just another person handling your items. Remember, when you're done shopping, I would say before you come into the store, if you can, use hand sanitizer, wash your hands. But definitely when you're done shopping, when you go into your home, first thing we should be doing is wash your hands and make sure that those surfaces and that packaging material is clean. So hygiene both at the store and at home will go a long way into keeping things clean and keeping things healthy for everybody.
Thank you for that. Very good, very important point. Even so much as when you're pumping your gas, I had that reminder as well that that's definitely a communicable site that we're all sharing, and to be mindful of that when you're pumping your gas. One question that's also surfacing here that I'm seeing, and I apologize if I keep switching my head. I'm looking at the laptop as well as some folks helping me monitor social media for those online are wondering what I'm doing. But the folks are wanting to know how are they going to be able to get bottled water if supplies are running short.
And when we talk about supplies running short, we definitely have seen that some of our shelves are empty of some of those items, but it's something important to note that, we don't have any disruption to the Port of Alaska at this time. They've remained committed that the ships are coming in on schedule, and the Port of Alaska if I recall correctly, and somebody can correct me if I'm wrong on my percentage, but I believe brings in 94 or 95% of all of the freight into our state via those ships that comes into the port up in Anchorage. So with that still continuing, we can be rest assured that the supply chain is still intact. There's definitely freight that comes through by land through the Canadian border. Most folks are aware that that was closed or is just about to be, but they are still letting those cargo, the trucks and those things through for essential shipments. So the supply chain is intact. I'm going to go back to some things that have been said at many levels, and part of the disruption that we're seeing in not being able to get bottled water, not being able to get other things is simply buying of large quantities, and families buying maybe more than they need for their immediate needs. So I really want to encourage folks to think about that and buy what you need for your family, of course, but there's no real reason to be hoarding or overbuying or doing any of that. Specifically talking about the bottled water scenario, if you have trouble getting that water at home, well issues or whatever it happens to be, there is also services that are local in the state that have some type of reverse osmosis systems and things that can also provide purified, clean water without it necessarily coming through that supply chain in the same way. So really the take home on that would be right now is I think everybody needs to just be mindful of how much they're buying. The ships and the cargo is continuing, so you can check in. I know some of the stores, just to keep that down, are instituting some limits, which is a real wise thing to do in these times. I think everybody feels a little bit anxious, but really remember that supply chain is still intact. The ships are still coming, and those things are still occurring.
Very good. Wanted to bring a question regarding the latest health mandate, and it was released today. It says at the top of it that it has a lot to do about out-of-state travel recommendations and why it's so important. What is the connection between traveling and potential spread here in Alaska?
So we know that there's a lot of very dense cities down in the lower 48 that have, and there's definitely clusters of infections that we've confirmed. Seattle is a great example of that, where many of us may connect through if we are traveling. By bringing people in through the state, remember the key thing here on this virus is that you could potentially have it, could be a carrier, could be transmitting it without showing any symptoms. So, and that can happen for anywhere from 2 to 14 days. I think right now they're thinking the average for most folks is that happens is about maybe 8 to 9 days. Again, things change on a daily basis. So by curtailing that travel, by getting rid of the opportunity to go through those dense airports, those dense cities, we can help flatten that curve by preventing that spread here. Really, you've been hearing it a lot. You've been hearing this happening in other places, but it's something that's just so important for us right now. If it's at all possible, stay home. Stay home, prevent the spread, keep people safe, flatten that curve. What we are ultimately trying to do is to not overstress our healthcare system that we've seen in other countries and in other municipalities. So if we can keep that spread down, if we can keep that curve down that you might hear us referring to, there's a visual on social media and some about that, but that helps prevent the spread. So that travel mandate or that travel advisory or health advisory that came out isn't a mandate, but in the strongest language recommends that we really postpone all of our travel out of state. If you have family, if you have folks that are coming in from out of state, you need to be quarantining, self-isolating yourself for 14 days, making sure that even in your home, you're keeping that social distance with loved ones who may not have traveled. So stay home if you can, work with your employer and things. If you do have a position that can do remote work or have some other sort of scheduled shift, if you do have to go to work, make sure you work with your employer on how to do that physical distancing. Like we are at the Borough, we've changed some shifts around with some of our workforce being remote. We've made sure that our desks that are usually fairly close together, that density has been gone. So talk with your employer, take those measures to stay at home.
Thank you for that. One of the things that's been brought to my attention is I think a very good a very important question, which has been discussed today at length during our regional phone call. And for those that don't know, every morning regionally across this entire borough, agencies, whether it's our nonprofit, healthcare, local, tribal, federal entities, come together and talk about what are those needs that are coming up. What is that lean forward that we should be preparing for? And one of the questions that was brought up today was our vulnerable communities. And the question is even being asked today is, is there a plan being discussed to set up emergency homeless shelter if a community begins to see a heightened number of positive cases? And is there, well, that just popped away from me. Oh, I'm so sorry, the way it's scrolling. But in essence, is there a plan in place?
So that was brought up. We started talking about that yesterday, and we're just in the very beginning stages of that planning process. And there are really some nuances that we talk about. And we talked about this as we talk about vulnerable populations, whether that be homeless populations or one of our other populations that are more at risk. But we also had the discussion today, and we sort of joke in my business that it's not only one bad thing that happens. So if we had some other type of emergency where normally we would potentially set up some sort of sheltering or some sort of congregate area to take care of people on a temporary basis, we can't do that anymore. We still have to be able to do that while maintaining that physical distancing. So that might potentially mean different facilities, different staff training, different precautions being taken to do that. So I don't have a solid answer on what that plan is yet, but it absolutely is being discussed and in that planning process. So we do have some contingencies going forward.
Thank you for that. One of the things that I think is also on everyone's mind is, have there been more cases announced on the Kenai Peninsula? Can you address that question?
Yep, and as of this evening, there have been no additional cases on the peninsula. I know there has been some talk, and we talked last night, if you tuned in, about rumors and unverified information. So there have been no new cases confirmed on the peninsula. If there are, they will be announced through the health authorities and also repeated on KPB alerts on Facebook or kpboem.com, which is your source for verified information from both the borough and all of the agencies that we work with across the peninsula.
We were going to end here in a couple of minutes. We wanted to broadcast from 7 to 7:30. And in closing, would you mind sharing with us what this blog is? What is this kpboem.com you're talking about?
Of course. So what we call our Virtual Joint Information Center, or just the blog for short, is a repository for folks to get information that comes from those reliable sources. So where we might see on social media, for instance, maybe somebody's repeating something that doesn't have a source or we don't know where that came from, that blog site is a chronological listing of things that may be contributed to by the borough, by cities, by official announcements from the Department of Health and Social Services, who's leading the response to this in the state of Alaska, our nonprofit agencies, anybody that has a role and that has legitimate information to put out. So we always really want to encourage folks to use that website, to use KPB alerts on Facebook and Twitter, to go ahead and get that legitimate information. If you've got questions, that's the place to find the answers, and you can also share our posts and our links from there. Again, there's a lot of misinformation. It's not always anybody's fault, but we see things that come up on social media. Maybe there's rumors. They're just simply things that are unverified. That does nobody any good to be sharing that and to be circulating that around. That legitimate information is available on that blog. So bookmark that on your phone or on your computer, KPB OEM. So for Kenai Peninsula Borough, Office of Emergency Management.com. But of course, OEM and many of the other agencies contribute to that same website. So we don't want you clicking around and having to go to all these different sources. It's a one-stop shop.
It is a one-stop shop, and it's been in place for several incidents now, and it's updated according to how we're responding, and whether it has local, tribal, state, federal It is a one-stop shop for this incident, and it's continuing to get updated with links that are important to our residents. And we're right at 7:30. I want to close. I'm gonna say a couple comments, and I'm gonna give it to you for closing if I can. Excuse me. Is that this is an unusual challenge for us as information officers, because our job is to interface with the public, and that's very difficult to do when we're asked to remain physically distanced or we're asked to work indoors. And so I'm asking our residents, please take a moment on this particular platform, where this string of comments that we're doing tonight, and truly write out, what do you want to see? What else? What are we not answering for you that potentially we can provide you the correct information for? I'm asking personally, as a fellow resident, I want to make sure that we are doing the best job possible for you. And this is not by any means a political platform, but I am asking for that information, and we'll do our best to get you those answers. And with that, I'm going to turn it to you for closing comments, Dan.
That's great. And thank you to all of our residents that do take the time on this comment string to leave that. And, you know, Brenda hit on a very good point that this is also a little bit unusual for our incident management team. You know, only a few of us are actually within any sort of close proximity. And of course, we're doing our own physical distancing and sanitation constantly, but most of our folks are remote, and they're contributing to us, you know, from their homes and doing those types of things. So it's a little bit of adjustment for us. We always thought we were pretty good with technology until we realized we had to be 100% reliant on it. But we're learning how to video conference and how to use these cameras and microphones and all those types of things. So I certainly hope that hooking this up to the Facebook Live is being helpful, and we certainly appreciate it. And of course, we are here each night, just as a reminder, at 7 o'clock. So in closing, on behalf of Mayor Charlie Pierce with the Kenai Peninsula Borough, all of the city mayors and city managers, I want to thank you for joining us. Encourage you to please follow these platforms, and then also just encourage you to let us know if you have questions, if you have concerns, if you're seeing things that aren't met. That comment string, some of our phone numbers and things are of course on our website. You can reach out to us. Again, please be a little bit patient with us as we're just dealing with a tremendous number of phone calls and things, but also let us know how we can meet those needs. We're adjusting each and every day, and I have a great team of people here, made up of borough employees, made up of volunteers and experts from all other places that have worked on many, many incidents in the past. And we're here to make sure that government services remain and that we have the best coordinated response to mitigate and minimize the impacts as much as possible. And we know that might sound a little bit hokey right now for me to say minimizing the impacts after all that we've gone through as a state, as a borough. We're not done yet, but we are committed to making that the best that we can. And we're going to get through this situation like we get through as Alaskans, helping each other out, being kind to one another, and just doing the best we can with the limited resources we have. So with that, we will be back tomorrow night at 7. Please leave those comments with things as Brenda asked. I want to wish everybody around the borough a very, very good Friday evening. Hope you have a great weekend, and we'll talk to you soon.
Good night.
Good night.